Hello there, this is Emmanuel Kahase. I am a clinical program manager at Clearway Health. Welcome to NSP 2024 in Nashville. Here I am presenting a poster titled The Values and the Pitfalls of Using the Routine Assessment of Patients' Index Data, number 3, commonly known as RAPID-3, and how its aggregate scores is used in making clinical decisions or interventions in patients with rheumatoid arthritis. So as a general background, rheumatoid arthritis is a systemic autoimmune disease that primarily involves the synovial joints. And the most common symptoms of rheumatoid arthritis include inflammation, joint pain and swelling, and morning stiffness. The American College of Rheumatology recommends a treat-to-target approach in RA management or in rheumatoid arthritis management, where the target of the therapy is to either achieve disease remission or low disease activity. And as you know, there are several clinical and patient-reported outcome assessment tools at our disposal to help us objectively assess disease progression or response to therapy. One of the several patient-reported outcomes available to us is RAPID-3. And as you can see in the top middle section of this poster, the RAPID-3 questionnaire has three domains that are assessed independently first, and their scores is aggregated later. So the purpose of this study is to investigate the alignment of the scores of the 3 domains of the RAPID-3 questionnaire with the final or the aggregate score, and how this may be used to tailor a clinical intervention. This is a multi-center retrospective observational study, and we use a descriptive analysis to present the data to you here. Data was collected from Clearway Health's patient-reported outcome and pharmacist intervention dashboard, and patients were included in this analysis if they were enrolled in one of our multi-site specialty pharmacy service that we have starting from January 1st, 2024 up to May 25th, 2024. So RAPID-3 is a validated patient-reported outcome instrument that helps us assess disease activity in rheumatoid arthritis from a patient's perspective. So as you can see in the top middle of this poster, RAPID-3 have 3 domains. The questionnaire had 3 domains, right? The first domain assesses the patient's day-to-day activity or functional assessment of the patient. The second domain assesses pain level, and the third would be a global assessment of the patient well-being. And as you can see, each of these domains are weighed equally with a score ranging from 0 to 10. And these scores will be added into generating the cumulative score ranging from 0 to 30, and that cumulative score would be then converted using a conversion table into the weighed final score. So if a patient's score is between 0 and 3, that means the patient have achieved remission. 3.16 means low disease activity, 6.1 to 12 means moderate disease activity, anywhere more than 12 means the patient is having severe disease activity. So in this study, what we did was we compared the individual domain scores with the aggregate score, and specifically looking into patients that has scored more than 6 in their RAPID score, which means patients who either have moderate disease activity or severe disease activity. And by the end of the study, 40% of these patients actually achieved their therapeutic goal, which means either they have achieved remission or low disease activity. 33% had moderate disease activity, and 26% had severe disease activity. Even though almost more than half of these patients had either moderate or severe disease activity, the final analysis also shows as more than 48% of these patients with moderate and severe disease activity, their RAPID score is actually in decline, even though they didn't cross the line to have a low disease activity, but the trend is going down, which is a great indication. However, when you look at the functional assessment of the patients who had moderate and severe disease activities, more than 76% of these patients had scored low in that domain 1, which means they had little to no functional limitation on their daily life. as a result of RA, which means there is a discordance between the functional assessment and the pain and overall global assessment. A closer inspection of this course also revealed more than 50% of these patients who either have moderate disease activity or severe disease activity, they did score more than 5 out of 10 in each of the second and the third domain, the pain and the overall global assessment. That is why we see patients who have very low physical limitation, but they end up scoring high on the global assessment and pain due to other reasons, and the final score will land them into either having a moderate or severe disease activity. So further, what we did was we took a look at the three questions in the first domain. As you can see in the top questionnaire, in the top middle section of this poster, the first domain, which is the functional assessment domain, has 3 extra questions added into that. These 3 questions will assess the patient's depression level, anxiety level, and whether they are able to have a good night's sleep or not. These are asked to patients, but they're not factored into the overall RAPID-3 scoring. So this is like bonus questions. So surprisingly, as you can see in the bottom graph of this poster, quite a significant portion of these patients with moderate and or severe disease activity are dealing with depression, anxiety, or sleeplessness with some difficulty or much difficulty. So this can translate into having score of high in their domain 3, which is a global assessment, because the global assessment is not specific to RA, like as I said previously. So in conclusion, while RAPID-3 is a validated and useful patient-reported outcome tool to assess disease activity in rheumatoid arthritis, the cumulative score should be interpreted carefully when being especially used for therapy optimization or therapeutic decision-making process. For example, a patient with fibromyalgia and rheumatoid arthritis, even though the rheumatoid arthritis is in good control, because of the fibromyalgia, they may score high in their pain level, and that high score can skew the overall RAPID-3 score into the higher section. And if you do not factor in the comorbidity that the patient had, you may be tempted to change therapy in RA while the therapy is actually working. So that's all I have for this poster, and thank you for stopping by this poster, and looking forward to discuss this in more detail during the poster session and get your feedbacks as well. Thank you.